This is Retirement Keys with Anthony Congemi from Crescent City Retirement Group. When a part of your financial strategy is out of tune, your long-term goals, your retirement savings, and your legacy can all suffer. With many years of experience in the financial industry, Anthony provides his clients and prospects with the information they need regarding Social Security, retirement income planning, wealth management, and much more. Listen in as we address your financial concerns and provide helpful solutions to put you on the path to achieving your retirement goals. And now, here is Retirement Keys with your host, Anthony Congemi.
All right, welcome to another show of Retirement Keys. I'm your host, Anthony Congemi, and we have our fabulous co-host with us, as we do every Sunday, Tony Shore. Tony's really been so instrumental in the success of our radio show on Sundays, really just bringing a wealth of knowledge all over that he really extracts from many retirement firms all over the country. So we're really so happy to have Tony Shore with us today. So Tony, thank you so much for joining us and being with us. And how you been doing?
Well, I've been doing great. And let's just remind the listeners, though, that you're the financial expert here, Anthony. I learn from you each week.
I appreciate that.
That's how this works. But you know what? I have been doing really well, and thanks for asking, because there's a couple of things going on right now, Anthony. Number one, I love the fall. I love fall weather. I love this time of year. And number two, I got to go down last weekend and visit my parents, mom and dad, and it's nice to see them because, you know, they've had some health issues and health struggles over the years. And my mom has Parkinson's, but she's been doing pretty good lately. My dad's doing good. And I also got to visit with my 100-year-old grandfather.
Oh, wow.
Who had a stroke a few weeks back and is almost fully recovered. And the doctor said it's a miracle at age 100 that he could recover from that stroke, and mentally he's fine, and he's starting to walk around with the walker again. It's unbelievable, really. You want to talk about longevity and healthcare in retirement, which I know we're going to get to in a minute here, so that'll all tie in. But Anthony, first, what have you been doing? Now, I know the fall is usually a busy time of year for financial services professionals like yourself, right?
It is, Tony. Well, it's end of the year, planning as it relates to tax planning, Roth conversions, Medicare, of course. We're in the enrollment period with Medicare Advantage plans, Part D, drug plans, October 15th to December the 7th. So, yeah, wrapping up the year and making sure that we've done all we can do to, close the year out for our clients successfully is a busy time for retirement planning firms. So we've been busy, Tony, and like you, I do love the fall. I think, definitely you can see really it's just so nice. The weather's cool. People are out, at parks. And I think that, I don't know, it might be my imagination, but it looks like people are just in a better mood.
Yeah, no, I agree.
Yeah, I think so. And so it's just the weather's been beautiful here. Of course, we're still cleaning up, and so many, Tony, are still in our area are still dealing with the aftermath of Ida.
Sure.
I was just on the phone with a client of mine earlier today and, hearing about what's been going on with her and, roof issues. And I'll tell you, just you wouldn't think that a bunch of shingles blowing off of a roof could create the devastation that it can. But when the shingles blow off and if water starts pouring in, you could literally, in her case, about 75% of her house was destroyed because of just all the water coming
damage.
into the walls and inside the walls and the sheetrock. And so, we're still cleaning up, but, a lot of people are, moving down the road and getting that done, Tony. But, the fall has been definitely a welcome time for us here in this area as well. And
Yeah.
so,
Yeah.
and it's fun too, anticipating, the holidays, Tony, just so much going on,
Oh, yeah.
family events and getting together with family. Of course, I don't have a whole lot of family left, as far as aunts, uncles, grandparents. I guess the older you get,
Sure.
your family thins out a
Yeah.
little bit.
Yeah.
But I got a big tribe myself. So as you know, I got four boys.
Oh,
So
yeah.
anyway, yeah, it's
Yep.
been good,
Yeah, I
Tony.
love your boys, and even I know your oldest son there has been working with you a little bit, or one of your sons there. I met
Uh-huh.
a couple of them while I was there at the office this last time, getting your recording studio set up. So your new offices are great. I mean, I guess they're not brand new anymore, but if our listeners haven't visited you there, I want to encourage our listeners to pick up the phone and give you a call, because you can have a complimentary consultation. There's no cost, no obligation, and get a financial plan in place. See where you're at least. Have some reports run and see that great new office. And you got a great client lounge, customer lounge there with your recording studio set up, and a great view too from those new offices. So I think it's great. Now, our topic for today, you wanted to talk a little bit about Medicare because it's open enrollment, and Medicare and healthcare costs have just gotten so crazy, and there's been so many changes that I think this is a good thing to talk about right now, isn't it?
Yeah, I think it always is, Tony. As we work through our five keys to a stress-free retirement, and we talk a lot about healthcare planning in a retirement plan. It's in a holistic plan. It all works together, but of course, healthcare planning is a big part of it. And as a matter of fact, Tony, when we do our workshops and our dinner workshops, as you know, we do them every month at different restaurants. We'll start off and ask people, what are some of the main things that people concern themselves with, as it relates to retirement. What do people, and I hate to use the word worry, but what do people concern themselves with? What do they want to make sure they have a good plan in place for? And invariably, you'll always hear, well, what if I get sick, or, health care, or the health care costs. And so people know instinctively that health care planning is a big part of retirement planning. And you need to have a plan in that regard, or it can be very expensive, and it can really wreak havoc on any retirement plan if you run up these big healthcare costs and you don't have proper coverage.
Yeah, exactly. And especially this time of year is when people are looking at their health care plans because of open enrollment. And I know Medicare open enrollment is right now. It's October 15th through December 7th. And people think, I think a lot of us, and I used to think this way before I started working with you, Anthony. I always thought, okay, once I'm retired or 65, I'll be on Medicare and I don't have to worry about health care anymore or health care costs. But that isn't the case, is it?
Well, no, Tony, there's really two primary or fundamental directions you can go as it relates to your Medicare planning. There's what we would call original Medicare, fee for service. And this is the little red, white, and blue card, Medicare Part A and B. And typically, if somebody has this fee for service or original Medicare, they'll have some type of a supplement to fill in the gaps. And then they have Medicare Part D, which is the drug portion.
Sure.
So that's one way to go. The other is the Medicare Advantage plans, Tony, as you mentioned, where it's you have a network of doctors and hospitals and specialists. So this open enrollment period, Tony, relates to the Medicare Advantage folks and Part D for drugs. So if you're on a Medicare Advantage plan and you want to change and go to a different plan, you can do, or a Medicare Part D for the drugs, you can do that between, as you said, October the 15th and December the 7th. So there's a lot of going on in that regard to make sure that, okay, we've got the right plan for the area that we're in. We like the providers that we have, and this shopping that's going on from one plan to another as it relates to these Medicare Advantage plans. And then again, the drug plans, Tony. And as far as the Medicare drug or Medicare Part D, of course, formulary lists can change. Maybe you're on medications that you weren't on, prior to this enrollment period. So maybe there's a different drug plan that would work better for you based on the medicines that you're taking. So, this is a good time, Tony, because of all those reasons, and being that there is a window, if you will, from October 15th to December the 7th, to just make sure, hey, have the best plan or the right plan for me going into 2022, and all that has to be worked out through this period, Tony.
Yeah. Yeah, and that's important, and I'm glad you're talking about that today. I think a lot of us, I know I, for one, I always thought, okay, Medicare, that'll cover it, but Medicare costs money. And it doesn't cover everything. Basic Medicare, to really get full Medicare coverage, there are still premiums, there's still deductibles, so you do have to cover that. If things like long-term care, hearing, dental, vision, none of those are covered by standard Medicare. And that's where you have to look at these other plans to make sure you're getting the coverage you need, but at the same time minimizing your healthcare costs and how much you're spending. I think that's the big trick. And our listeners can do that. You help people you help your clients with this, right?
Oh, absolutely, Tony. I mean, you're right, and it's a balancing act. But as you mentioned, medical costs, hospitals and doctors, prescription drugs, of course, long-term care. Once somebody is discharged from a hospital and they need to go recover, whether it be in a skilled nursing facility or assisted living, or really most people want to stay home and recover. Of course, the nursing home is another environment, but all of this, Tony, does have a cost to it, and it can be very expensive. And, if you have a plan in place, whether it be your health care plan for your medical, hospitals, doctors, your Medicare plan, and your long-term care plan, it all goes under the umbrella of health care planning. And it all works together,
Sure.
And so at the end of it, you really don't want to just it's good to do an evaluation of your medical plan, and then where my medical plan leaves off to where my long-term care plan is going to pick up. And I'll give you, just kind of a quick, example of that, Tony, just one example of many, but skilled nursing, for instance, in a lot of plans, Tony, they'll pay for 20 days of skilled nursing, but then from the 21st to the 100th day, you could have a pretty sizable deductible. So if somebody goes and they get discharged from the hospital and they go into a skilled nursing environment where there's skilled folks, right? Physical therapy, speech therapy, inhalation therapy, all of these skilled folks. They're in this skilled nursing, Tony. And after about 20 days of that, Tony, it can really start costing you some money. So for folks that get discharged from the hospital and then they need to either go into a skilled nursing wing to recover or go home and recover, it can get very expensive, Tony. So again, where does your medical plan leave off and where does long-term care kick in? And making sure that we don't have these big gaps in between is really the key here, Tony, because the time to find out about, well, hey, I didn't know that wasn't covered, or gee, we could have had something in place, but we weren't aware of it. The time to find out is not when you're in the middle of it, right?
Right.
It's certainly looking at all of your health care options and making sure that you understand the schedule of benefits, making sure you understand what coverage you have, what coverage you don't have, and then how it can all work together. Because, at the end of the day, Tony, what can wreak havoc more on a retirement plan than having some, big medical expenses or long-term care expenses and not really having a plan in place. All of a sudden, you could be spending thousands of dollars every month on health care. And really, that can wreak havoc on a retirement plan,
Sure.
obviously.
Yeah, obviously. And that's huge. And I'm glad you mentioned that. Now, we should probably take a quick break here, but before we do, Anthony, let our listeners know how they can set up that complimentary consultation to go over their plan for Medicare, healthcare, and retirement, or that overall retirement income plan, just to have a plan with their finances.
Absolutely. So, you know, we have a great website, crescentcityretirement.com. Just log on there. You can, hear this show and many other past shows. A great way to schedule an appointment with us on the website, or simply call our office at 504-828-2171. The consultation is free. We will go over all of your health care options, Medicare. As a matter of fact, we have a really in-depth, it's about an hour and a half, 2-hour educational workshop strictly on healthcare planning, Medicare, and long-term care. So we're able to just really do a good job in our own offices, in our own classroom, do a good job just, doing a deep dive, if you will, into Medicare, long-term care, and all the nuances. So you really are educated on the different options that are out there. So I would just encourage you. Obviously, healthcare planning is a big part of an overall retirement plan. So give our office a call and just, let the ladies know that you heard Tony and I discussing this Sunday, and that you would like a complimentary consultation, and we'll make sure we get it scheduled for you.
Yeah, that sounds great. And listeners, stay tuned. We're going to be right back with more of Retirement Keys and our host, Anthony Congemi, right after this.
You've been listening to our shows and advice on getting your finances in order and creating a retirement income plan that will last. Now is the time to take advantage of our special offer. This is Anthony Congemi of Crescent City Retirement Group, and we're now offering a complimentary gourmet dinner and retirement planning workshop, the 5 Keys to a Stress-Free Retirement. This is one workshop you won't want to miss. Call in the next 20 minutes for this no-cost offer. Seating is limited. Call Crescent City Retirement Group within the next 20 minutes at 504-828-2171. That number again is 504-828-2171.
And welcome back to Retirement Keys. I'm your co-host, Tony Shore. I'm here with our host, Anthony Congemi. And Anthony, great show so far today. We've been talking a lot about Medicare. It's open enrollment right now, so it is time to reevaluate where you're at. See if you can maybe save some money on your health care, and at the same time, make sure you're getting the full coverage you need for everything and that you need. And I think that's a big deal. A lot of seniors and people in retirement have issues with they're on Medicare, or their plans don't cover everything they need, or B, maybe they're overpaying. So it really pays to sit down with a fiduciary and a Medicare specialist. And I know that you're more than happy to talk to folks about this, Anthony. And, healthcare is such a big part of retirement. You talk about the keys to retirement, and really having a plan in place that incorporates healthcare costs is a biggie, isn't it?
Oh, absolutely, Tony. It really is. And understanding where the gaps are. A lot of times sometimes we just don't know what we don't know. But if you have it all spread out in front of you, and here's kind of a key term here, Tony, is schedule of benefits. Schedule of benefits. So when we have a schedule of benefits in front of us, we can really see exactly whether we're talking about original Medicare, traditional AB Medicare, or we're talking about a Medicare Advantage plan. If we have a schedule of benefits, we can see exactly, what Medicare does, let's say Part A for original Medicare, Part B, exactly what the gaps are, and exactly how the supplement is going to fill those gaps. Or on the Medicare Advantage side, exactly, if I go into the hospital, or if I have a, surgery, or if I have these special tests, or these MRIs or CAT scans or blood work or whatever it might be, what is my out-of-pocket cost, and what could my annual out-of-pocket cost be? So really understanding the benefits, the schedule of benefits, is really a great step in the direction of, just understanding what you have, right? And so from there, then when the gaps are identified, and there are gaps, but when the gaps are identified, we can go about the business of saying, okay, what's the best way to fill these gaps? And then sometimes there'll be gaps identified, and we, and we don't want to fill them, or we're okay accepting that accepting that risk, if you will. And that's okay too. Long-term care is a great example of that. A lot of times, people see the gap and they see what the cost is if they had to pay for it themselves. But a lot of times people will say, well, but we'll self-insure in that area. So if we do have this expense, or if this happens, then we'll try to pay for it ourselves. And but really understanding what those gaps are and what the costs are is really a great way to get started with that, Tony.
Yeah. Yeah. And that's huge. And so obviously to have that all planned out is so important. And, you have to know what the costs are and know what all the options are. And what I always find amazing, Anthony, is how much things have changed. I mean, Medicare changes even from year to year, a lot of health plans and what you can get. Sometimes they've improved things and you can get more for less, but you have to reevaluate. A lot of people probably think, well, I've got my Medicare set and, I haven't had any problems. Well, yeah, but you have no idea what's available currently, and things change and the plans improve. So you really want to make sure that you're getting the coverage that you can get for the least amount of money. And that's so important. And I think everybody should do that and look at where things are at right now. And that's a big part of it. Now, obviously, there's a lot of healthcare issues in retirement. Long-term care is one. And Anthony, long-term care is not covered by Medicare.
Very, very little, Tony.
Yeah.
Very little. A very small amount, of it as it relates to skilled care.
Sure.
And I will say, Tony, and just kind of piggybacking on what you mentioned about the Medicare piece, it's also the networks and the providers and the second opinions and the freedom of choice and where you can go to get the care and all, and the nuances of how the plan itself works. All of that is important as it relates to your healthcare planning. As you mentioned, long-term care is not, Medicare is your medical care. And even though you can do a real deep dive into these Medicare workshops and you're right, every year there are changes, there are nuances, things work a little different. And frankly, that's why, the workshops and the material do change. The deductibles change, co-insurances change, networks change. So being informed, and that's why you have this window of opportunity. I mean, that's the whole point of the October 15th to December the 7th, to say, hey, let me make sure that what I have is bringing me into 2022. And I've done my due diligence. I've looked at the options, and I have the best plan for me based on the information, that I can have moving into 2022. So that's the opportunity that you have, is to really just do a good, deep dive into your healthcare planning. And as you know, Tony, in our workshops, the 5 keys to a stress-free retirement, we talk a lot about, obviously estate and legacy planning, investment strategy, income planning, taxes, but healthcare is a big part of that as well. And that's part of the 5 keys, to have that healthcare plan. So if you had to go into the hospital, or you had to go into, you had a medical condition where you needed rehab, whether it be in a skilled nursing facility or assisted living, or God forbid, even a nursing home, that you have plans in place and you know what the cost would be. And we have some plans to cover that cost, because let's face it, what's more expensive than these high medical costs? And, we spend a lot of time in our retirement income planning, structuring income and making sure we have enough income coming in retirement. But you've got to consider too, when you're pulling money out, especially pre-tax dollars in retirement plans, that is a taxable event. So if you're in pre-tax dollars, let's say in an IRA, a traditional IRA or 401k, and you're going to use that money to supplement, let's say, your long-term care expenses, that could be a very costly and a considerable tax event in doing that, Tony. So yes, it's interestingly, when you look at a retirement plan holistically, healthcare planning, tax planning, your income plan, your investment strategy, your estate plan, how things are going to pass on. It really all works together, Tony, and it can all support each other. Each piece of the plan can be a real support for one another. So I would just encourage our listeners, if you don't have a formal retirement plan, really a written plan that looks at these 5 key areas, I would encourage you to just take a minute, give our office a call, look us up online, schedule that consultation. I have a real special offer I'd like to make you, so please take advantage of it.
All right, and we'll roll right out from there. Good show today. Thank you for listening to Retirement Keys. Don't pay too much for taxes or retire without a sound income plan. For more information, please contact Anthony Congemi at Crescent City Retirement Group. Call 504-828-2171 or visit the website at crescentcityretirement.com. All matters discussed during this show are for informational purposes only. Each individual situation may vary, and the opinions expressed here may not apply to everyone. Materials presented are believed to be from reliable sources, and no representations can be made as to its accuracy. All ideas and information should be discussed in detail with one of our qualified representatives prior to implementation. Anthony Congemi and Crescent City Retirement Group are not affiliated with or endorsed by the Social Security Administration or any other government agency.